Laura Ingraham is just furious that more people haven't died from coronavirus, and we knew that this would start happening. I just didn't think it would happen so quickly. This is a version of what I call the anti-vaxxer conundrum. I'm not saying Laura Ingraham is an anti-vaxxer, but this is the anti-vaxxer conundrum. And falling for it or deliberately perpetuating it, depends on your view. But this is what Laura Ingraham is doing on her show. She is putting out this fury, this anger that in the end, fewer people are going to die from coronavirus than the number that might have died had we not taken it seriously. Let's watch the clip, and then I'll explain what I mean by the anti-vaxxer conundrum.
And by the way, another cost of these lame panic-inducing models, it looks like we really didn't need the USS Mercy or the USS Comfort in New York or Los Angeles. Americans should be furious about this. Of course, the men and the women in these ships that are doing their patriotic duty, they're amazing. The commanders, amazing. But this is a lot of money that we're spending on a response that was based, again, on faulty numbers. Now, long before the government figured out that these fancy COVID-19 models were wrong, my own little team, little band of medical advisors and a few statisticians, they're a lot smarter than I am, insisted that they had also crunched the numbers. And this was weeks ago. They were making decisions, the people in charge, based on what my team said were wildly incorrect assumptions and ultimately incomplete data.
So there is a ton here. The whole point of a model is what would happen if we don't change what we're doing right now. So the numbers aren't faulty. It's that we control the outcome by our actions. You would think someone who subscribes to the idea of personal responsibility would understand our actions determine our future. So when the model said before we shut anything down, based on the contagion rate and the death rate and viral spread, this is pointing to 1.5 to 2.2 million people could die in the United States, or maybe the number is 300,000 to 500,000, depending on which model you looked at. We then did stuff, right? Like shutting things down, reducing contagion, reducing spread, which then modifies the curve, changes the trajectory, and we have new data with which we make a new set of projections. And of course, the projected deaths decrease the more stuff that we do. So people have been sitting at home for a month, many of us, 5 weeks, the ones of us that took this seriously right away and had a responsible governor. Obviously, that will improve the projections and decrease the death toll. She is visibly mad that more people haven't died, which in her mind means everything we've been doing was pointless. And this is the anti-vaxxer conundrum. Anti-vaxxers will often say, measles vaccine. Measles is so rare, we don't need a vaccine. The reason measles is rare is because we've had a good vaccine for a long time now. If we didn't have it, more people would get measles. Having it makes people think we don't really need it. Anti-vaxxers seem not to understand this, or at least pretend not to. Lots of coronavirus contrarians, as they are sometimes called, appear not to understand that we bend the curve. The curve doesn't have unlimited power. It is not omnipotent. We shape it by what we do. We should be glad we had more resources deployed than necessary. And this is why the healthcare system needs to be outside of the for-profit system. In the for-profit system, being proactive and being ahead of things, being prepared, is not rewarded. It actually doesn't even fit with healthcare as a for-profit entity. In the mind of someone like Laura Ingraham, a hospital ship that didn't end up being used, or ventilators that we didn't end up needing, that's a sign of failure. Because if you consider profit the primary goal of the healthcare system, it has failed. It deployed resources that weren't actually needed. It's a waste of money. Now, if you believe that the healthcare system's primary goal is to keep people healthy, then when you hear, hey, you know what? We were able to get more ventilators than most states needed. Not all, but most states needed. Or we had a ship that ended up only being used a tiny bit. You're happy about that because the goal is taking care of people, not making money. So you say, hey, wow, we were more prepared than the level of disease we ended up having. That's a success. When you believe the primary goal is profit, a ship you don't need, or ventilators you don't use are considered signs of failure. That's why healthcare should be outside of the for-profit model. These people at Fox News are sick. Imagine being furious that we reduced the death toll. Real quick, I want to tell you about our sponsor, Magic Spoon, who have done something awesome. They've taken all of our favorite sugary childhood cereals that we know we shouldn't eat anymore and turned them into something you can actually feel good about eating as an adult. There's 4 flavors: cocoa, fruity, frosted, and blueberry. They taste great. They're crunchy. They're sweet like you would expect this type of cereal to be, but it's perfect for a ketogenic diet because one bowl has only 3 net carbs, 12 grams of protein. It's sugar-free, gluten-free, grain-free, soy-free. Once our team tried Magic Spoon for the first time, we actually ended up emailing Magic Spoon back and saying, can you send us more boxes? Send more samples. They've been a big hit with David Pakman Show staffers. And Magic Spoon knows how delicious their cereal is because if you don't like it, they'll refund all of your money, no questions asked. And you'll get free shipping when you go to magicspoon.com/Pakman and use the code Pakman. That's Pakman.